Newcastle West pilot addresses the musculoskeletal pathway, so people with problems with spines, joints, muscles and tendons, and it's an attempt to make the pathway more efficient from early stages where people need attention right the way through potentially to surgery. And it's been important because it's been a partnership between the GPs and the commissioners, ourselves, Connect Physical Health, who are a community provider of musculoskeletal services, and Newcastle Hospitals Foundation Trust, who provide secondary care services.
We knew that we had some very good services, but they weren't as joined up or as smooth in the way that they looked after patients as we knew they could be. So we agreed that we could build something better, and we felt we should pilot it. What we've been doing is working with 9 practices in the West End of Newcastle who have been piloting a joined up and complete pathway for looking after our patients who've got problems with muscles and joints.
The main objectives of the pilot was to provide excellent care to patients, to provide a pathway that was joined up from start to finish for patients, and to move care out of hospital into the community alongside the Department of Health policy. The access to physiotherapy could involve very long waits, and while patients are waiting for physiotherapy, their condition can get much worse. So the first change in the pathway was to introduce a physiotherapy service that was very accessible and easy to get into on GP referral. PhysioLine service was a telephone access for patients that was within 48 hours. In addition to the specialist physiotherapists within that service, we put in a sports and exercise medicine consultant and orthopaedic surgeons so that patients could access a good level of specialist care in the community without going to the hospital.
Physiotherapy has really helped me overcome some of the issues I've had. They've helped me get back to fitness quicker than I would have without it. The sessions with Connect have been fantastic. They've been a real help to get me back on track, and kind of after you've been in, I really feel the benefits.
It was so quick. The beauty of seeing the doctor and then going to the physio through Connect. I had the treatment in my own surgery, which was very, very close to where I live, and I could walk there. From my point of view, it was the speed of someone saying, she's in pain, have some physio, and I had it when I was really needing it and didn't have another few weeks to wait. You know, sometimes you're talking about hospitals and you're talking about, well, it might be under 3 months, you know, we'll try and do it within 10, 12 weeks or something like that.
For the Hospital Trust, what it means is that we see the patients that we definitely need to see in the right place at the right time. It reduces unnecessary patient visits. If they come to us from Connect, for example, they've potentially already had an MRI, which means we don't put a delay into the pathway for the patient. It means that we can operate on them much sooner than potentially we would need to if we were working them up from the absolute beginning.
I saw a woman in late middle age who had been living with arthritis of her hip for quite a long time, and it was now having a really major impact on her ability to get around, and she was in a lot of pain. So I knew that I wanted her to be seen in a community setting by an orthopaedic surgeon, and made the referral to our intermediate service. I met her a couple of weeks later, looked at her x-ray, which confirmed that she had really bad arthritis of the hip, and said, so you'll be hearing soon from our service with an appointment to see a surgeon in a few weeks' time. And she said, no, I'm seeing the surgeon tomorrow. And within that 2-week spell, not only had I managed to get an x-ray and an x-ray result back, but the next day she was seeing the consultant, and she did get listed for surgery from that appointment, and within a matter of a few weeks was having her surgery. So she was pretty impressed with that, but so was I. It was an example of a patient experience and an experience for me as her GP that was just absolutely fabulous.
So the importance of the findings of this study are that we can provide more care of high quality to more people for less cost. The cost of the service compared to before the pilot was £84,000 cheaper over 12 months, and that's for around 70,000 patients. The implications of the financial savings across the country as a whole are quite phenomenal. I think for the future, for musculoskeletal care, this sort of pathway is something that I would suggest is incredibly important for CCGs to take on board.
When you make a pathway function well and really serve its purpose, you can then concentrate on how do we look after people as early as possible and as effectively as possible so that they don't go on and develop the more severe problems. And that's been a big learning point for the 9 practices and for us as commissioners. What we hope to do with all of this information is now build this on a much bigger geography and to open it up to all the other practices in the city who would be interested in seeing exactly the same benefits for their patients.